Calling all smokers, calling all non-smokers. Grab your newspaper, grab your newspaper. We have a public health issue, and it's smoking. Issued Tuesday, September 29th, 2015. I chose to do smoking because my grandma Elaine, who is a 5-year breast cancer survivor and a fighter to lung cancer, passed away from lung cancer November 3rd, 2012, at the age of 65. She smoked nearly her whole life. Tobacco statistics. Tobacco kills. Tobacco use kills more than 5 million people a year. That's a lot. It takes responsibility for 1 in 10 adult deaths. More than 70% of deaths from lung, trachea, and bronchus cancers are from tobacco use. If current patterns continue, tobacco use will kill more than 8 million people per year by 2030. All of these stats were found from the World Health Organization. Now don't let your life be destroyed like this cigarette. Secondhand smoking. You aren't just killing yourself, you're also killing your family, your friends, your peers, your coworkers, everything around you. The nicotine also gets on things, so you're getting it into other people's lungs. I have a family friend from my hometown that passed away from secondhand smoke. He received lung cancer from secondhand smoke. He never smoked a day in his life. More than 600,000 people died from secondhand smoke. Health risk that smoking can and probably will cause. Smoking can harm every organ in the body. 90% of lung cancer deaths are from smoking. Here's a smoker's lung compared to a non-smoker's lung. Smoking can lead to stroke and coronary heart disease, which are the leading causes of death in the United States. I found these results on publichealth.org. A short public announcement. Smoking kills.
Smoking causes sickness and disability, and it kills. There are more than 4,000 chemicals in tobacco smoke, 60 of which are known to cause cancer. Smoking harms nearly every organ in the body, reduces your health, and causes many diseases. Let's see how it affects the smoker. It causes oral and lung cancer and increases the risk of many other cancers. It also causes breathing problems and increases the risk of dangerous infections like pneumonia. Smokers have more of a chance of having a heart attack and are twice as likely to have a stroke. Smoking can even accelerate hair loss in men. Smoking also affects the eyes, and smokers are more likely to develop cataracts as they age. And it raises the risk of developing weakened bones or osteoporosis. Smokers tend to have yellow teeth and develop gum diseases, persistent bad breath, and other oral hygiene problems. Above all, it kills 5 million people every year and makes many more fall ill. Passive exposure to cigarette smoke also damages health. Not only to themselves, smokers also expose others to tobacco smoke in offices, homes, and public places. Those most at risk are their own family and friends. Passive smoking exposes non-smokers to most of the same toxic gases, chemicals, and fine particles that smokers inhale. Passive exposure causes similar health effects as for those who smoke. Children are particularly susceptible and are more likely to suffer from asthma and serious lung infections. Cigarettes contain nicotine, which is highly addictive. Some research has suggested that it can be more addictive than heroin. Even if you want to quit, you may find it difficult because you are addicted to its effects. So it's important never to start smoking, as it is difficult to stop later, and if you already smoke, stop as soon as possible. Now's the time to quit smoking and tell others how to do the same. Life is better without smoke.
Smoking leaves an unseen scar. It fills your insides with toxins and tar. Here's a tip from a former smoker, found on the CDC website.
The first time I had a cigarette, I was in 5th grade, and my friends were smoking. Everyone I knew smoked, definitely. All the older kids I knew smoked, and I thought I should smoke to fit in. Everyone in my family smoked, and I was smoking every day by 8th grade. Smoking has caused a lot of pain in my life. I lost my grandfather to lung cancer. I had my first child 2 months early. My dad, who I smoked many cigarettes with, now has stage 4 lung cancer. And I know that by sharing the pain and the hurt that smoking has caused in my life, that it's going to help people quit smoking. When I was a senior in high school, my grandfather was diagnosed with lung cancer. They gave him 6 months to live, and he only lived like 3 or 4 months. And that was that looked like a horrible way to die. And after that, I knew I didn't want to get sick like that from smoking, but it wasn't enough to make me quit. And now my dad's not even 50, and he has stage 4 lung cancer, and I'm hopeful that he's not going to die soon, but it is stage 4 lung cancer, and I have 3 kids, and the oldest is 7. I have a 4-year-old and a 1-year-old, and I know that my 1-year-old might not ever remember her grandpa.
No, I hope I've reached out to you. I hope you think about the next time you pick up a cigarette, or before you even think smoking for the first time. Thank you for your time. And remember, don't let your life be destroyed by smoking.